Welcome to the Key Health. We unlock and enlighten you daily. Today, we are going to talk about hypertension. The video presents the pathophysiology of hypertension in the simplest way possible for anyone at any level to understand. We will cover definitions, pathophysiology of the disease, the risk factors associated with the condition, clinical manifestations and the relevant methods to treat the disease. The presented information blends the observations highlighted by publications ranging from the World Health Organization, the Center for Disease Control and Prevention, and notable scientific works covering specific aspects of hypertension. According to the World Health Organization, there are about 1.13 billion people are living with hypertension worldwide. Disclaimer: this video is for educational purposes only. Please seek medical advice if you have symptoms that may be mentioned here. Self-treatment could be dangerous and may lead to self-harm or death. Let's dive right into it. Hypertension disease disorder definition and explanations. According to the World Health Organization, hypertension refers to a condition where patients' blood vessels have a persistently raised blood pressure. The condition is also referred to as high blood pressure. The biological functioning of the blood pumping and transport mechanism relies on the balance of the pressure along the blood vessels around the body for optimal performance. The higher the pressure, the harder it becomes for the heart to pump blood and substantially yield enough power to have the blood reach the peripheral organs and back. As the heart attempts to accommodate the increased pressure, a person becomes vulnerable to suffering from other conditions affecting organs such as the heart, the brain and the kidney, among other complications that would arise due to altered perfusion. Let us look at pathophysiology. Blood pressure is the result of the interaction between the amount of blood that is pumped out of the heart and the resistance the blood experiences from the walls of the arteries. Therefore, an increase in the volume of blood pumped by the heart and a subsequent decrease in the diameter of the arteries provides the best recipe for high blood pressure. Blood pressure is presented in a fraction version figure with the pressure readings following the standard values of pressure, that is millimeters of mercury. The numerator value represents the systolic pressure, which represents the pressure of blood within the arteries when the heart beats. The denominator represents the diastolic pressure, which represents the blood pressure when the heart is resting between one beat to the next. Hypertension is a hideous disease, with most of the people expressing no symptoms, even when the readings are alarming. However, headaches, dyspnea and nose bleeding might occur, though the signs are not sufficient to diagnose one as having high blood pressure. There are two types of high blood pressure, that is, primary hypertension and secondary hypertension. Let us start with primary hypertension. Primary hypertension, also known as essential hypertension, has no known cause but develops over many years and is common in patients above 20 years. According to the Center for Disease Control and Prevention in America, men have a 50% chance of developing hypertension as compared to the 44% probability in women. Further, hypertension is more common in non-Hispanic Black adults at 56% than in non-Hispanic white adults at 48%, non-Hispanic Asian adults 46%, or Hispanic adults at 39%. Secondary hypertension. The condition develops abruptly, usually indicating a significant alteration of the functionality of the body organs such as the kidneys, altered hormonal balances, and as response to medications such as decongestants, birth control pills among other prescription drugs, and/or injection with illegal drugs such as cocaine. Pregnancy, in some instances, results in secondary hypertension, requiring increased directed care to the patient. This is necessary as the condition negatively affects pregnancy, resulting to premature births, preeclampsia or even stillbirths. Risk factors. There are several risk factors for hypertension which are not limited to the following. Age. Similar to most other functionality conditions, the body loses vitality as one ages, thereby becoming susceptible to development of conditions such as high blood pressure. Race. Africans are at high risk for the development of hypertension. In a future video we will handle these factors extensively. Genetics. Family history is a risk factor especially for essential hypertension. Overweight and obesity. The accumulation of body fat around the arteries increases their resistance to blood flow. Further, pumping blood through the increased mass for nutrient supply and removal of waste poses a heightened supply challenge for the heart, thereby yielding increased blood pressure. Tobacco use and physical inactivity. Excessive alcohol intake. Altered sodium-potassium balance. The alteration of the concentrations of the sodium and potassium ions have direct implication in fluid balances within the body. Low potassium levels lead to accumulated levels of sodium, which promotes retention of body fluid that would otherwise have been eliminated, resulting in increasing blood pressure. The most notable manifestations are heart attack, heart failure. Due to the persistent pressure put on the heart, the myocardial muscles adapt by thickening, causing left ventricular hypertrophy. The changes, though intended to counter the increased pressure, add to the complications such as stiffening of the walls and reduction in the volume carrying capacity, which alters healthy blood flow. Fatigue, heart palpitations and shortness of breath become common, with elevated stress, resulting to dizziness and fainting. Aneurysms, which is the weakening of an artery wall that creates a bulge or distension of the artery. That result from inconsistent blood flow in the arteries, with blood being caught in a specific weak part of a vessel, and the increased pressure leading to bursting of vessels, which can be life-threatening. Damage to the eye. Increased blood pressure damages the sensitive blood vessels supplying blood to the eyes. The damaged vessels lead to optic nerve atrophy. Retinopathy, where lack of blood flow to the retina leads to blurred vision or the complete loss of sight, and at times glaucoma. Increased waist size. And finally, memory loss and dementia. Treatment. Treatment of hypertension involves deliberate actions to change one's lifestyle. Patients are placed in programs to assist in quitting smoking, managing alcohol problems, undertaking physical exercises. Other applicable interventions are determined by the physician as may be deemed fit. Among the interventions for dealing with hypertension include dieting, which involves ensuring that the diet is low in sodium and high in calcium and fiber. Medications are also administered, such as calcium channel blockers like amlodipine, beta blockers like loprosur, diuretics such as microzide, angiotensin II receptor blockers like Cosir, renin inhibitors such as aliskiren. I hope the information contained in this video is helpful enough. Comment with your views on how helpful the videos was and/or what you would want us to add. Also, we are looking for health topics you are interested in viewing. Write your topic in the comments section and you might be surprised when we feature your topic in a future video. Thank you for watching and welcome for more. Subscribe, like and share our videos.